Upon completion of this DVD, you will be able to identify the elements of a comprehensive assessment, explain the criteria for performing a comprehensive assessment on the home care patient, describe a systematic method for performing a head-to-toe nursing assessment, identify key parameters to assess in a head-to-toe assessment, name at least 3 components of a complete physical assessment that must be performed on each body system, which, if missed, may result in mismanagement of the patient's treatment. In home care, a comprehensive assessment combines both Medicare-mandated OASIS items as well as additional assessment details that relate to the home environment and the patient's informal support systems, taking into account the adequacy of available agency staff and services to safely meet the patient's home care needs.
Just open your mouth. You have all your own teeth? Okay,
No,
good.
I have bridge
You have bridge?
across the top.
Okay.
All types of home care agencies conduct a physical assessment of their patients. The extent of the assessment conducted depends on whether or not the agency is Medicare certified and consequently must comply with Medicare conditions of participation, the agency's license type, state regulations, agency policies, and standards of practice. Considerations also include confidentiality, patients' rights, and consent to treatment. In addition, for Medicare-certified agencies, the Medicare conditions of participation require that a comprehensive assessment be conducted within 48 hours of referral or within 48 hours of the patient's return from a hospital or institution, or on the ordered start of care date. It must accurately reflect the patient's current health status and the need for home care, and include information to demonstrate progress toward desired patient outcomes. When indicated, the assessment must incorporate Medicare's OASIS items. OASIS is not meant to be a full physical assessment, but rather is integrated as a part of the whole comprehensive assessment, utilizing observation, interview, interaction with the patient and family, objective measurements, and data from other healthcare provider sources. For home care agencies not guided by OASIS, the extent of their comprehensive assessment may vary, depending on the type of licensure, state and accreditation requirements, and the clinician's own standards of practice. Primarily a nursing function, the physical assessment provides baseline data from which to draw information for the formulation of the patient's plan of care. The following home care physical assessments will focus primarily on these 2 patients. Infection control practices are important considerations in home care, including appropriate hand hygiene, bag technique, and standard precautions. Performing a physical assessment in the home requires compliance with all of these principles. Agencies may provide a standard bag and equipment, or the clinician may be responsible for obtaining his or her own bag and supplies. The equipment may vary depending on the needs of the clinician. Regulations require the employer to provide personal protective equipment. For example, OSHA requires PPE respirators for active TB cases and requires the employer to provide appropriate PPE in situations where blood and body fluids may pose a hazard to employees. In a home care setting, the environment is often less than ideal for performing a physical assessment. When this is the case, the clinician must improvise. Privacy is ideal, but often a caregiver is not only helpful, but vital. Other factors to consider include adequate lighting in a comfortable space, preferably where the patient can lie down, limiting distractions by turning off the TV or radio, and having pets secured in another area, facilitating patient interaction, and allowing the clinician to conduct the physical assessment properly. Establishing trust and a working relationship with the patient is critical to the accurate collection of data from the assessment process. Bedbound patients or patients with dementia pose a particular challenge to home care clinicians. But by utilizing appropriate assessment techniques and involving the families and primary caregivers, these patients too can be adequately assessed. Prior to conducting the physical assessment, it's valuable to obtain a thorough health history. When possible, review the patient's past history, establishing the current problem that needs to be addressed for home care. Identify any patient allergies. Obtain the patient's height and weight as reported by the patient and preferably confirmed by measurement later. Complete a thorough medication drug regimen review. Other OASIS items collected prior to or during the visit, not specific to physical assessment, are clinical record items and patient identification items, MU 010 to MU 100, demographics and patient history, MU 140 to MU 290, living arrangements, MU 300 to MU 340, supportive assistance, MU 350 to MU 380, therapy need, MU 825, emergent care, MU 830 to MU 855, and discharge disposition information, MU 870 to MU 906. In home care, a comprehensive assessment combines both Medicare-mandated OASIS items as well as additional assessment details that relate to the home environment and the patient's informal support systems, taking into account the adequacy of available agency staff and services to safely meet the patient's home care needs. In addition, for Medicare-certified agencies, the Medicare conditions of participation require that a comprehensive assessment be conducted within 48 hours of referral or within 48 hours of the patient's return from a hospital or institution or on the ordered start of care date. It must accurately reflect the patient's current health status and the need for home care and include information to demonstrate progress toward desired patient outcomes. When indicated, the assessment must incorporate Medicare's OASIS items. OASIS is not meant to be a full physical assessment, but rather is integrated as a part of the whole comprehensive assessment, utilizing observation, interview, interaction with the patient and family, objective measurements, and data from other healthcare provider sources. Prior to conducting the physical assessment, it's valuable to obtain a thorough health history. When possible, review the patient's past history, establishing the current problem that needs to be addressed for home care. Identify any patient allergies. Obtain the patient's height and weight as reported by the patient and preferably confirmed by measurement later. Complete a thorough medication drug regimen review. The actual physical assessment is a head-to-toe systems review. In the Medicare agency, this includes specific OASIS items that must be completed. The assessment is done by a combination of inspection, palpation, percussion, auscultation, interview, observation, and measurement. OASIS items will be identified on screen when applicable. The appropriate MU item will be shown on the screen for reference. The assessment starts first with the patient's general appearance, then proceeds to specific systems. The clinician may begin with vital signs, blood pressure, pulse, respirations, temperature, as a way to build the patient's trust and confidence. This gives the clinician an overview of posture, motor behavior, dress, grooming, and personal hygiene, which we will return to later in the video. Then the clinician starts a head-to-toe assessment. Inquire about any dizziness or headaches, and assess the head for swelling or tenderness, hair color, texture, and distribution.
Do you have any cataracts or glaucoma?
I had cataract surgery about 2 years ago.
Right or left eye?
Both eyes.
Okay. So they're surgically repaired?
Yes.
Okay, good.
Inquire about glaucoma and cataracts. Check pupil reaction to light, whether they respond equally, and assess peripheral vision. Determine if the patient can read medication labels or admission forms. Find out if the patient uses glasses or contacts.
Rosie, can you please tell Zoraida that I'm going to be checking her vital signs, checking her blood pressure, her temperature, and her pulse, since we're already done with the paperwork?
Oh, dice que después de que termine de llenar el papel.
It is important to assess the patient's ability to understand spoken language. If there are language difficulties, determine the need for translation and/or a caregiver for accurate assessment.
Jack, how is your hearing?
I need hearing aid.
Okay, both ears?
Both ears, yes.
And you have them in today, good.
Also check for hearing aid use, right and left, and check for earwax. Administering a whisper test may also be beneficial. Assess for aphasia and comprehension. Assess the nose and sinus for appearance, obstruction or patency, any discharge, pain or tenderness, bleeding, and color. For the neck and throat, assess for the following: frown-smile facial symmetry, swelling, lymph nodes, carotid artery and jugular veins, hoarseness, ability to swallow. Assess the tongue and gums, teeth and dentures. Look for evidence of thrush, ulcerations, a gag reflex, and presence of, or a scar from, a tracheostomy or previous surgeries. Note any assistive devices the patient may currently use, such as sheepskins, pressure pads, special beds, or other durable medical equipment, or DME. If none are in use, consider their need as you assess the integrity of the skin. This item refers to the presence of a skin lesion or open wound. Skin assessment includes skin color, presence of moles, infection, skin lesions, bruises, masses, scars, rashes, incisions, and discolorations. For OASIS purposes, any ostomy or peripheral IV access site is not considered a skin lesion. Assessment of invasive items include entrance or exit sites of peripheral catheters, peripherally inserted central catheters or PICCs, other central venous access devices, and access sites for enteral nutrition, such as a G-tube or J-tube. Therapies the patient receives at home, such as IV infusion, TPN or enteral nutrition, and the presence of ostomies are noted as well. Skin assessment also includes assessing for the presence of pressure ulcers. If present, further clarification is indicated. The clinician must observe for and document the number and stages of observable pressure ulcers and the status of the most problematic pressure ulcer, documenting the degree of healing visible. Also document the presence of healed pressure ulcers, as this skin area is susceptible to breakdown. The clinician must also assess for the presence of a stasis ulcer, the number of observable stasis ulcers, if there are any unobservable stasis ulcers, and the status of the most problematic observed stasis ulcer, describing the degree of healing present. If the patient has a surgical wound, and this includes infusion access sites, assessment and documentation should reflect the number of surgical wounds, whether any are unable to be observed due to the presence of a non-removable dressing, and the status of the most problematic surgical wound, identifying the degree of healing visible.
I'm going to check and see how hydrated you are, how much fluid you're getting in, make sure you're getting enough and that you're not dehydrated. I just pinch your skin a little bit and see how fast it returns back to normal.
Skin turgor is also evaluated. Does the patient experience pruritus or itching? Is there abnormal presence of hair? Assess the toes and fingernails for color and quality of nails. Patients receiving chemotherapy may have specific skin and hair issues. Wound care and prevention of decubitus ulcers in home care can be a challenge. Accurate assessment of the patient's skin will provide a baseline for preventive measures to be taken to foster good patient outcomes. Patient and caregiver education regarding prevention strategies is vital. Use of the patient's own bed and supplies must be considered, along with whether appropriate durable medical equipment is necessary for the patient's care. The assessment starts first with the patient's general appearance, then proceeds to specific systems. The clinician may begin with vital signs, blood pressure, pulse, respirations, temperature, as a way to build the patient's trust and confidence. This gives the clinician an overview of posture, motor behavior, dress, grooming, and personal hygiene, which we will return to later in the video. This item refers to the presence of a skin lesion or open wound. Skin assessment includes skin color, presence of moles, infection, skin lesions, bruises, masses, scars, rashes, incisions, and discolorations. For OASIS purposes, any ostomy or peripheral IV access site is not considered a skin lesion. The cardiorespiratory system is composed of the circulatory systems, heart and blood vessels, and the respiratory system, including nose, pharynx, larynx, trachea, bronchi, and lungs, delivering oxygenated blood to the entire body. Cardiovascular disease is one of the most frequent conditions seen in home care. To assess the cardiorespiratory system, check the patient's vital signs, including temperature, blood pressure, both on the right and the left. If the patient's diagnosis is cardiac in nature, assess the blood pressure with the patient lying, sitting, and standing. Assess the patient's pulses, apical, brachial, radial, popliteal, and pedal. Assess for rhythm and quality, and measure the rate, rhythm, and depth of respirations.
Are you having any shortness of breath when you're walking?
A little bit.
Okay.
OASIS item MOO 490 requires documentation of when the patient is dyspneic or noticeably short of breath, and MOO 500 asks what respiratory treatments are utilized at home, including oxygen, ventilators, or CPAP, continuous positive airway pressure. Assess for dyspnea on rest, exertion, palpitations, murmurs, claudication, paroxysmal nocturnal dyspnea, chest pain, fatigue, orthopnea, document the number of pillows used, cyanosis, presence of a pacemaker, any varicosities, and other cardiac problems. Edema can be measured with a standard tape measure for accurate assessment. Assessment of breathing patterns includes whether the patient uses pursed lip breathing techniques. In further assessing the patient's breath sounds, the clinician assesses whether there are stridor, crackles, or rhonchi, wheezes, or pleural rubs heard on auscultation. Does the patient have a cough? Is it a productive new cough or a chronic cough? Assess the frequency of coughs and assess the sputum. Ask about night sweats. Does the patient have a history of asthma? Assess for shortness of breath, MOO 490, and endurance.
Jack, are you using your walker when you're here alone fairly consistently
Yes,
to
I
prevent
do.
falls?
Yes, I do.
Good.
Yes.
Are you having any shortness of breath when you're walking?
A little bit.
Is the patient able to ambulate greater than 20 feet, less than 20 feet, climbing stairs, dressing, eating, talking, or are they short of breath at rest? These items may also impact on the patient's homebound status, a required assessment for eligibility for Medicare services at home. Respiratory treatments, MOO 500, identifies the type of treatments the patient receives at home, and MOO 790, management of inhalant mist medications, assesses the patient's ability to prepare and take all prescribed treatments and medications. If the patient is receiving oxygen, assess the patient's oxygen use. How frequently do they use the oxygen and at what flow rate? Assess and document the amount in liters per minute, or LPM, whether it is continuous or on an intermittent PRN basis, how it is administered, nasal cannula or mask, and what situations require it. If possible, determine their oxygen saturation with a pulse oximeter. The clinician should instruct both patients and families on home oxygen safety. Be sure appropriate signage is clearly visible in the home, warning of oxygen use and advising no smoking. A breast exam is most conveniently performed after the cardio assessment while the chest area is exposed. It should be done in both males and females, but less extensive in the male. Assess for lumps, tenderness, discharge, and pain. While assessing, the clinician can also educate the patient on self-breast exam. The musculoskeletal system provides shape and support to the body, allows for movement, and protects the internal organs. It contributes to the production of red blood cells, assists the circulation of blood in the body, and stores calcium and phosphorus in the bones. As part of the musculoskeletal assessment, observe the patient dressing, putting on shoes, combing hair, bending, sitting, and ambulating. Assess for edema. Assess for any history of arthritis, gout, joint pain, swelling, or stiffness. Assess for weakness, muscle strength, the presence of an amputation or prosthesis. Observe the legs, including extremity temperatures and deformities. Assess the use of durable medical equipment, DME devices, such as a walker, cane, wheelchair, and commode. And assess ambulation, holding on to walls, furniture, devices, steadiness, distance tolerance, and breathing status. Assess the patient's history of falls, their frequency, and any associated injury. Identify the patient's rehabilitation prognosis for their functional status for MOO 270.
When she has pain, where does she have pain?
Cuando tienes dolor, ¿dónde tienes dolor?
And assess for pain, frequency of pain that interferes with the patient's activity or movement, MOVE 420, and intractable pain, that which is not easily relieved, occurs at least daily.
What triggers the pain?
It's hard to say. I sometimes wake up, get out of bed with
And affects the patient's sleep, appetite, physical or emotional energy, concentration, personal relationships, emotions, or the ability or desire to perform physical activity. MOVE 430. In a non-verbal patient, assessment of pain includes observing facial expressions, behavior, and vital signs changes. The musculoskeletal assessment includes assessing for homebound status for the Medicare agencies. As one of the requirements for Medicare to cover home care services, a patient must be considered essentially confined to their place of residence. Psychiatric patients who may not safely be out on their own may also qualify as homebound. Homebound status would also be a part of the clinician's assessment under the Neuro-Emotional Behavioral System Review. The neurological system acts as the main circuit board for the body. It allows interaction with the external environment through stimulation of nerve endings, provides the interpretation of these impulses, and directs the body's reaction to these stimulants. It also maintains the activities of the internal organs. The neurological assessment includes headaches, dizziness, syncope, seizures, paralysis, leg cramps, numbness or tingling, tremors, aphasia or inarticulate speech, assessing for comatose state, and a pain assessment.
When she has pain, where does she have pain?
Cuando tienes dolor, ¿dónde tienes dolor? Regularmente en my back y en mi pecho.
For all patients, a pain assessment is necessary. In many